Now we're going to be talking about acute silhouettitis, and this is the inflammation of a salivary gland that can be caused by infectious agent, irradiation, or any kind of immunological disorder. Um, it can have a bacterial or viral cause, such as an infection with CMV, staph, staph aureus, staph pyogenes, strep, pneumonia, or E. coli. It usually affects the parotid or the submandibular gland in adults. So a decrease in the production of saliva, especially in our dehydrated or debilitated patients or those who are NPO status, especially postoperatively for an extended time, can lead to acute salidodenitis. That's a very hard term to say. The bacteria or virus can enter the gland through the ductal opening in the mouth, and some systemic drugs can also trigger episodes of this as well. Untreated infections of the salivary gland can evolve into abscesses, which can rupture and it can spread. So for a treatment, especially those patients who are receiving radiation, they can be predisposed to acute or persistent salivary gland infections. And that's usually a rapid, and it's very dose related, especially if we're having head and neck radiation. They usually do very, very high doses of radiation. So you'll see this a rapid onset. Usually during the initial interview, when you assess your patient, assess for any predisposing factors for this, any ionizing radiation to the head or neck. Thorough drug history is important. Ask about any systemic illnesses such as HIV. Look for any kind of dehydration. Basically, we need to hydrate the patient in our interventions, application of warm compresses, massage of the gland, use of any saliva substitutes, and use of our solilogogues, any substitutes, any substances that can stimulate the flow of saliva is important. And those include your lemon slices, citrus flavored, and other fruit flavored candies will help with that. The best way is to prevent acute salidodenitis is to do routine oral hygiene. Very, very important. And this basically prevents infection from ascending to the salivary glands, to the mouth itself. We're going to pause for a minute and then go on to post-irradiation salidodenitis. Okay, now we're going to talk about post-irradiation salidodenitis, and this is real important because you can have exposure from radiation therapy for head and neck cancers, thyroid cancers, that can produce what they call xerostomia, which is a very dry mouth caused by that severe reduction in the flow of saliva, usually within 24 hours of the patient getting irradiated. That xerostomia can be temporary or can be permanent, and depending on the dose of the radiation, as I said before with salidodenitis, the acute stage, and the percentage of your total, how much gland tissue is irradiated, so it's all depending on that. Little can be done to relieve the patient's dry mouth, especially during the course of radiation therapy. Those frequent sips of water, frequent mouth care, especially before meals, are usually the most effective intervention. And after the course of radiation has been completed, they usually do the saliva substitutes. And as I said before, the really sad thing is that it can be temporary or it can be permanent with these patients. So that's a really, really difficult thing to deal with our patients that have that head and neck cancers.